As we've discussed previously, the flex tube breathing circuit does have the capability to transfer to a transport capability, and did want to go over the various options. When at the end of the case, when the patient is ready to be moved from the operating room to the PACU, there are certainly some cases where the patient will still be intubated or have a supraglottic airway device in place, and they will continue to be need ventilatory support. They may be breathing spontaneously, but they would like to have the option to be able to manually support ventilation as well. To allow this to occur, use just the transport kit, and this connects directly here. You use the breathing bag off of the anesthesia machine, and then the oxygen oxygen tubing is connected to the oxygen flow meter. You control the thumb slide valve here to control the outflow of gas to maximize whether or not you're delivering manual ventilation. And again, at the other end, this will be connected to either the supraglottic device or the tracheal tube. Now, if the patient is awakened in the operating room and they have the tracheal tube or supraglottic device removed, then it's a much simpler connection. This adapter goes right onto the oxygen flow meter, connects directly onto here. At this point then, you're disconnecting from the supraglottic device or tracheal tube, and you're using some sort of a oxygen mask or oxygen tent. And in this case, you're just providing supplemental oxygen during the wake-up period to address postoperative nausea and vomiting, to reduce the incidence. Now, obviously, if they're in this scenario and they somehow need ventilatory support, they will need a face mask or something to be able to ventilate should that need arise. For patients being transferred to the PACU with just an oxygen tent for supplemental oxygen delivery, the transfer is pretty straightforward. This adapter that's chained on here is installed into place like this. Upon arrival, disconnected from the tank here, installed here. Now what's happening is the oxygen is being blown through the outer limb of the breathing circuit, picking up some of the moisture that has accumulated and providing at least some level of humidification and avoiding the need for expensive bubble humidifiers.